Well, good morning. I'm King County Executive Dow Constantine. As we all know, our region is no stranger to national attention. For the last few years, the Seattle area was the prime example of the country's housing boom. Home prices increased here faster than anywhere else in the nation for, I think, 2 full years. And just this week, we are in national headlines again as point-in-time counts released by HUD reflect what we already know, that growing homelessness continues to be a regional challenge. Housing affordability, behavioral health needs, income inequality, and also systems like the criminal justice system and the child welfare system exit people into homelessness. All of these are considered to be root causes of homelessness. This past year, Mayor Durkan, Mayor Nancy Backus of Auburn, and I convened a regional group called One Table. And that was convened to fully understand all of the components of this crisis and how we can take the strongest measures as a region together to make a difference. Those conversations support our collective belief that we need a response system that unifies us and is equal to the challenge with which we are presented. King County, City of Seattle, our regional cities, philanthropies, businesses, service providers must all set aside our parochial interests and old ways of doing business in service of the greater good. We elicited the help of consultants, future laboratories, and the Corporation for Supportive Housing to develop recommendations that incorporated research on successful models for addressing homelessness from communities across the nation. This is our work to ensure that we are moving forward as one, not pointing fingers, but instead recognizing that we are all part of the solution. I am especially pleased that the voices of people with lived experience of homelessness were heard and reflected, and that going forward, they will continue to be core participants in this effort. Now today, we are embracing the recommendations we received and announcing our actions to implement them. We will engage community stakeholders, providers, and clients to shape a unifying plan to tackle homelessness for the region. Mayor Durkan and I will work with our respective councils to produce formalized agreements between our two governments, but let's be clear, we will stand up, we will staff, and we will fund a new entity, combining the homelessness work of King County, of Seattle, of All Home, and of our partners. When we join together, all levels of government, and here I want to call out our federal partners at the time, along with philanthropy, service providers, and private landlords, we were able to reduce veteran homelessness in King County by nearly 1/3. There are thousands more individuals and families who need our help. There are many hurdles to pass. There are many questions to answer. But we are committed to this course because the challenge we face demands a response that is greater than what we can accomplish acting separately. As Mayor Durkan will stress as well, these reforms will not by themselves solve homelessness. But we must have a foundation that is data-driven, that is transparent, that is customer-focused, and we must have a single point of accountability for the region. It's my pleasure to introduce the Mayor of the City of Seattle, Jenny Durkan.
Thank you very much, Executive Constantine. You know, for many years there has been discussions about the siloed response and a number of reports that indeed confirmed that we need a systemic structural change to how we respond to the homelessness crisis. That's why Executive Constantine and I, and many of those who are here and those who could not be here, both signed and supported the Memorandum of Understanding that the Executive and I signed in May. We know for a fact that our response today is too fractured, which is why the County Executive and I are now moving forward to implement one unified system that has governance, authority, and the resources to address this crisis. The problem and need for regional and coordinated solution cannot be controverted. We know that government can't find these solutions alone. If I've said all along, and as the executive has too, we deeply believe that the challenge we're facing requires government, business, service providers, people with lived experience, and other advocates at the same table looking at both root causes and joint solutions. We also know that coming from the City of Seattle that we can't solve it alone. One reason is that a regional crisis has to have a regional response. And we simply don't have the capacity, Seattle alone, to do this alone. Second, we know that we don't, in the City of Seattle, run the continuum of care or the behavioral health system. So we need a systemic governance change where we bring all the components for addressing this crisis into one place so that there can be one place for solution. I'm very encouraged by working and talking to the other mayors around this region who also want to be part of this regional governance and response. They need to go back to their membership, and we're very cognizant that we have 39 cities in King County, and that each city has its own unique challenges and response, but we need to make sure that everybody can be at the table. We also know that we need regional responses to housing. That's a separate press conference. We know that in 2018, the city delivered the largest increase ever in the amount of shelter dollars in the history of our city. We have increased our shelter capacity, our emergency shelter capacity, by 25% in less than a year. And the county has been working to increase shelter capacity also, both in the City of Seattle and elsewhere. But we also know to prevent people from falling into homelessness, we have to do more. That's why in the City of Seattle, we launched the Seattle Rental House Assistance Program that actually has diverted hundreds of people from falling into homelessness. The county has similar programs, and I think you'll hear in the question and answer is one of the things this unified body will do is look at deeply how do we prevent people from becoming homeless rather than just deal with them in emergency response. Through the third quarter of 2018, the City of Seattle alone has served more than 22,000 unique households in the city. Over 22,000 unique households. And we've helped more than 5,700 households exit from homelessness by the third quarter. That's more than the whole previous year. That numbers is going up. We think we will reach 7,400 by the end of the year, which is our target. But we also know it hasn't been enough. We haven't been able to deal with it because it is a regional problem. On Monday, I was able to announce $375 million in affordable housing investments, which is the largest single investment that will happen in the city's history. That, together with the investments that we announced last year, totals over $600 million in just 2 years, dedicated to affordable housing. But again, we know we need to do more. And even as Seattle and cities across the region, King County, All Home, philanthropic community make progress, we don't think we can continue just to try to align individual efforts. We have to have more than alignment. We have to have a unified response. We're also in the process, as many of you know, of having a deep accountability review of our systems and our infrastructure, as well as how we have used resources to address this issue. We will have a unified plan that we can, as a group and as one unit thing, implement. We know that this mechanism won't solve homelessness, but we also know we cannot make the advances we need to make without this. And we're laying the foundation for a new era and a new approach to homelessness. We know that we have to have an entity that's almost as audacious as Metro was when it was first founded. What the exact structure of it is, we are not going to focus up front. We have to focus on the work and the people we serve to make sure we get that right. In the upcoming months, we will dig deeper into more detailed timelines and implementation plans, work with council on exactly what the structure looks like, but we are not stopping. We are not stopping today, and we'll begin immediately to adapt some of these recommendations and bring the work into one entity. And as the executive said, is that entity will be formed and it will be funded. I really want to thank the people who are behind me and those who couldn't be in this room on all the efforts this took over the last several months to work deeply and probably most important, to give a broader voice to the people experiencing homelessness so we understand exactly what do we need to do to raise those people up, to get them housed, and to solve this problem for the long term. I also want to thank the philanthropic and business interests, as well as the providers and the nonprofits, for not just being at the table, but making sure we got this right. And with that, I will introduce one of those, David BLEY, who is with the Gates Foundation.
Thank you, Mayor. I'm David BLEY with the Bill and Melinda Gates Foundation. And like everyone else here today, we're here for one reason, like everyone in philanthropy, which is we want to continue to build a community that reflects our values that we espouse every day, which are opportunity, which is equity despite whatever income or race or ethnicity you come from, and a spirit of generosity. We're in it for the greater good. Many of us could choose to work on other issues. There's so many priorities in this community. But in fact, it's hard to believe this can be a great city until we organize ourselves very differently to tackle problems that some people, these providers and others, have worked on for 4 decades or more. And the reason I'm here, and I'm excited to be here, is like the mayor said, this single announcement, this is not a total solution that we're talking about here. This is about how we have to organize ourselves differently, how we have to do business differently, because what we have learned is a precondition for success is to end the fragmentation, both across different levels of government and between business, philanthropy, and government. I'm very lucky to represent a much larger group of other philanthropists in the region who are very committed to this, who are seeking a sense of shared responsibility and mutual accountability to get to greater impact. And that ranges from philanthropy like the Gates Foundation that has been in this work for more than a decade, to other foundations that are new and willing to invest in new and different ways, to the business sector that we're going to hear about in just a minute. And it includes rock stars. And that's a great way to build some spirit because we do have to do business differently. I'll just end by saying we have been in this for the long haul. This solution that we're talking about today is fundamentally important. It is a prerequisite to greater success. And instead of viewing this every day as we walk the streets and read the papers that this is just a tragedy, instead we're saying we're going to work harder and we're going to work smarter and we're going to work differently to get to different results. With that, I'm going to turn to Leslie Smith from Vulcan.
Thank you, David. I'm Leslie Smith. I'm the Director of Public Policy at Vulcan. On behalf of Vulcan, as well as Marilyn Strickland with the Seattle Metropolitan Chamber, who was not able to be here this morning, we want to thank County Executive Constantine, Mayors Durkan, Bacchus, Chelmanak, and Council President Prince, as well as other electeds from around the region for their leadership on strengthening our region's response to homelessness. Like our philanthropic partners, the business community invests deeply in our communities. We want to do so in a way that is accountable, transparent, evidence-based, and results-driven. That actions recommended in this report put King County and cities in King County on a pathway to being more coordinated and accountable, moving to a system that is funder-driven, data-informed, and laser-focused on equity. Vulcan made a commitment to do this work in partnership. We support the implementation of these actions. And in large part, we made this commitment because it was important to Paul. With that, I'd like to introduce Councilmember Joe McDermott.
Thank you, Leslie. I come to the conversation today not only as a King County Council member, but as a member of the All Home Continuum of Care, and have been in that role for over 4 years and bring a passion to addressing the problem. From All Home's perspective, we bring federal funding that has been an invaluable infusion into our region to address the problem. In fact, about 25% of the funds invested in the region are through the continuum of care. And that success comes from our board, our partners, and the All Home staff who have been dedicated to making every success possible. I want to recognize them and commend them for that work. However, we here in our region will have frustrations sometimes about governance structures. We have experienced that ourselves and have voiced that ourselves as all home board members about the lack of all the connections that we see necessary and the isolation of some of our decision-making. We see conversations about bringing us all together and having a consolidated decision-making that brings all the investment and the partners to one place to be able to make those decisions imperative to being able to do that well. And the All Home Board looks forward to working together in pursuing the steps we need to take to be able to deliver effectively through our work and to even better invest in our community and resolve the crisis at hand. With that, I'd like to introduce AZIA RUFF. Good morning.
Good morning. Hey, y'all. So my name is AZIA RUFF, and I grew up in King County in South Seattle, and I turned out to be a 3-time customer of the homelessness system in my short life. And so that is a bit of background as to what brings me to this core working group and the executive leadership team for this planning process. And so with those many hats on, I want to say that I echo the statements about needed region-wide alignment in services and in funding for our homelessness response system. Because without it, we're just not doing the best things with our investment and all of that manpower. And I echo the need for a unified effort, both amongst the decision makers and sort of the players on the field, but also the customers and the people most impacted by those experiences. It's you can't be unified without having everybody there, and it's crucial that we have the people that are going to be living with the consequences of these decisions and on the processes and decision-making conversations that happen. I echo the need for business to be done differently through being accountable to customers and to community, both through new and improved communication channels between the community and the system that it serves, and to engage the community as key stakeholders as opposed to a passive recipient of money and services. How do you explain it? So yeah, it's important for us to include the community in these processes in order to actually act accordingly with our desire, our stated goal of centering people most impacted, of centering people most marginalized in our community. And the only way that we can make good on these statements and on these processes is by giving them the power back of being able to speak for ourselves and having agency over our lives and the places we go. When we honor people's wisdom and direction and their experience, we get to learn about them and understand them, and we're able to work in better partnership to just live together. And that can be tangibly done by, like I said, creating infrastructure that would allow customers to communicate with providers as well as the administrators and decision makers of the system. So by building those channels, not only are we building accountability into the system and building transparency into the system by taking out the middleman between the system and the customer, but we're also creating a source of crucial input that will inform our efforts, but also it gives people their power back by allowing them, like I said, to speak for themselves and have agency over systems that largely impact their lives. And with that being said, I'm honored to represent a lived experience coalition. That's the name, the Lived Experience Coalition, and it's a large group of individuals and individuals and advisory groups impacted by public mainstream systems such as the homelessness response system, the child welfare system, the criminal justice system, and the medical institutions of our community. We're a collection of people called the Lived Experience Coalition, and we are ready to be engaged as key stakeholders and as problem solvers in this work.
Thank you. And we will have questions, but also some conversation among us. One of the revelations, I guess, that has been provided by the active participation of people with lived experience, including AZIA and others here, is that that I've kind of realized that simply that providing the resources is insufficient to necessarily help people get to self-sufficiency, whether folks are coming out of a system like criminal justice system or the child welfare system, or whether they are coming from homelessness into housing. It has been emphasized to me that folks often need someone to walk the walk with them, perhaps someone who has already experienced what they have experienced. And so in our budget this year, we are creating a center for folks having behavioral health challenges where when they are in crisis, they can be met by someone who has experienced that same crisis and be able to get in and get stabilized without having to go through the formal mental health system. This is an approach that's worked well in other places. And it's an example of what happens when we begin to listen to those who've actually walked the walk. And so thank you for your contribution, participation, your ongoing commitment to help us get this right. Mayor Durkan.
I think we can open up for
Okay.
discussion and questions.
Great.
Executive Constantine,
Yeah.
once you have the system set up, will taxpayers asked to pay will taxpayers be asked to pay higher taxes or new taxes?
The first thing to do is to set up a system that uses the resources we have to greatest effect. And I think we have a long way to go in that, and that's why we're doing this. This entity will take on, I think, the emergency response part of the spectrum. And so we have a lot of different people doing a lot of different things around emergency response. Of course, outside of government, everyone will continue to do what they want to and do best and have it be aligned. But ultimately, the question of whether more resources are required or what part of this spectrum they're required in will need to be answered. And I think that our goal should be to get to the point where we're not having to invest so much in emergency response, and that can be shifted to the things that get to the root causes and get people back on track, rather than simply assuming we have to add money to all phases of this.
And let me follow up on that. I couldn't agree more, and I think you have to, everyone often will look at the emergency response and people who are experiencing homelessness and think that's the problem, why don't you fix that problem? But it is, number one, it's got to be human-based, and number two, it's not static. And we've spent a lot of time looking at the root causes that if we don't address those as a society, we will not improve the situation on the street. Let me give you one example. We talk about the foster care system, where we know at age 18, kids are on their own. I'm the mom of a 17-and-a-half-year-old. I can tell you that for almost any 18-year-old, that's too soon. But if you're a foster kid who doesn't have the connections, doesn't have the support, sometimes doesn't have the education, we are seeing categorically kids of color disproportionately go right into homelessness. That's something the state, once we have our group, we've got to put pressure on the state to fix. The jail and criminal justice system, our largest emergency shelter, sometimes on every night has up to 10% of the people are walking down the hill directly from Harborview Hospital or the King County Jail. So we know that the emergency response has to go upstream to not just the root causes, but to also look at housing. So I think it is premature to say, do we need more resources? We got to get a lot smarter about the resources upstream and those approaches and the upstream causes. And once we get this right, the goal is to have the smallest emergency response you have, because you've diverted people away from the system. If they just need 2 months' rent to get stabilized, you find a way to get them those 2 months' rent. If it's they lost a job and they need a job, you find a way to do that. If they need mental health or substance abuse or other behavioral health things, you get them that. So people experiencing homelessness, what that indicates more often than not is all the other systems have failed. We got to get those systems not to fail. And then as we do that, if we have one system and one approach, I think we'll get better and smarter about this.
Can you better explain what you mean by this entity? I was trying to think of examples. I mean, you have a county with 39 cities. Is it going to be like a United Nations approach where everyone pitches in?
Do we need translation?
Yeah, where everyone pitches in some money, but the accountability still rests with the individual cities, the county, on how that money is being spent. Can you better conceptualize what this entity is?
Yeah, first of all, part of the work is going to to be identifying exactly what kind of entity it is, including what kind of legal entity it is, and there's a broad spectrum of what it could be. But we will fund and staff this organization so that it can begin to do the work that is currently spread among different entities around emergency response, as well as the planning for our regional approach. And our investments will align around that regional approach, whether or not this entity controls them. For example, housing. You do a lot of housing. We do a lot of housing. Much of that has to do with homelessness, but a whole lot of it does not have to do with homelessness. So we will align our investments, but we'll not simply seed that entire body of work.
And give you two examples, Matt, is, we already have regional governance in King County Metro, and we have it in King County Seattle Public Health. Those are two models that you can look to. So what we really have to do is focus first on what's the work.
That's right.
How do we bring it together? How do we make sure that all the different cities feel like their issues are being addressed? And I think that's what's going to drive this. But the key is focusing on the work and bringing it all under one roof so we can provide the systems and resources that the public expects of us and that can help people experiencing homelessness.
Just a quick follow-up, because you, Mr. Constantine, you mentioned a single point of accountability in this. Does that mean that this would supersede the decisions by this entity, supersede what the mayor wants to do, what you may want to do in the county level in terms of homelessness?
I think within each of the sort of subsets of our work on homelessness, it will depend on how we decide to set this up and what both resources and authority and accountability we choose to invest in it. I do believe that we are working in an environment, in a state where we have sort of purposely decentralized power. We have aggressively fragmented systems in this state. And so part of our job is to figure out how we can, in the process of maturing our region at least, hand power, authority, resources, and accountability to an entity that can do the job in a unified, organized way. And I think we're up to that task.
How so often there are criticisms of there's a creation of a new panel, a new board, a new committee that's going to figure out what we need to do to tackle homelessness. How is this different?
Yeah, I mean, that is the inevitable criticism whenever you try to do something new. I mean, the thing we have now is doing a lot of good work, but it's not getting us over that hill and getting us to the solutions we want. The criticism is around whether we're just rearranging the deck chairs. We're rebuilding the ship. We're creating a vessel that can better accomplish what we want to do collectively.
And I'd follow up on that is this isn't something that we've just all kind of reached consensus on. We had Mark Dones and his organization do a very deep and thoughtful and analyzed report. And out of that report came on recommendations that we needed to take as a region to make our systems better. And that report is what we're going to be working on the framework with. So it is very much in line with what we know now we need to do to make sure that if someone is experiencing homelessness and comes to the front door of this new system, they will be asked the questions that we need to solve it. Why are you here? Oh, I lost my job, so I couldn't pay my rent. I got another job on the line, but I need 2 months' rent. Or I got sick and was in the hospital, couldn't afford to pay it, called into work. There is a myriad of reasons, and we haven't done a very good job on having a system that both ties our diversionary system, our emergency response system, our reemployment system, and our behavioral health. And we've got to bring that under one roof.
Can I offer one non-governmental thought on this one? Because we wonder the same thing as your questions. We've been working on this for a long, long time. And what is different today, in my opinion, is one, we actually do know a lot more than we've ever known before. And we do know that one precondition in other communities that have been more successful is a unified governmental approach. That's a fact. Two is why behavior has not changed in this region over many decades on this issue. There could be a lot of reasons why behavior hasn't changed, but what has convinced some of us to stay at this table is specifically individual leadership. Yes. We have elected leadership. That's the mayor, that's the county executive that have been willing to talk and act in different ways than any other elected officials have so far. I'm convinced that the time is right because of the immensity of this problem. And we ask where the suburban elected leadership is. They eventually will be here too. There's just a lot to be determined. And whether this is the United Nations or this is actually one entity is something we adults will have to figure out.
Could I add something from a business perspective as well? It is why business is at the table also, is that this time is different. For the last decade, I've been in every single one of these processes that the city of Seattle has done. And in large part, it's the leadership of the two people sitting immediately to David's right in terms of inviting the suburban cities, in terms of their commitment to working together. And their commitment to both standing up a new entity and doing a regional action plan. And that is what has kept us at the table as well.
Ms. Smith, if this time it is different, will business then have a different response if it comes down to new revenue, new taxes? Will business be supported?
Well, I believe that businesses in Seattle and across King County already contribute a lot to our community, and I think what you are watching unfold today is what business has been waiting for.
Are there any specific expectations that you have as far as this unification effort translating to better outcomes for customers or reductions in homelessness region-wide?
It should do both of those things. And I think if you look at the report that was done is, number one, it's going to be customer-based. Is really listening to what is it that people need to be stabilized and what is it we need as both cities and region and state to make sure it's systemic, that isn't one-offs, so that we have those systems in place that can address what we know what the issues are, and we know writ large what people need. We just not have been very good at having a unified response in doing that, so that if someone is in need of shelter and they're in need of behavioral health, they got to go to two different windows, you know? And what we have to do is when someone needs help, we don't want to say, you can get part of your help here, but walk across town to get the rest of the help and fill out forms. We need a person-centric system that looks at people as the humans they are and says, how is it we are going to change the trajectory of your life if we can? Rather than just put people into a system that works better than living on the streets, but has not transformed people's lives enough. That's the goal.
That speaks to efficiency, but is it too early at this point to talk about numbers, specific numbers as far as reductions in homelessness?
I think that it is a mistake to focus on numbers as an indicator of the problem. We know where the systems that are failing today, and if we don't work concertedly to work those as we work this emergency response, we will not see a change in just pure numbers. I think those numbers are reflective of deeper changes in the economy and in institutions that have not kept up with those changes. And so that we're focused today on the emergency response part, but the executive and I and the people in this room are also focused on those other changes that have to happen in tandem. But too often, I think we say, because we can't fix it all in this room, we're not going to fix any of it. And we're going to reject that.
And, you know, part of what we'll be doing in this entity in the fairly near term is identifying the metrics and milestones to measure success so that we can hold ourselves and the entire region accountable to making genuine progress. The 2019 steps, I would think, for this would include unifying prevention and emergency funding, those upfront and immediate issues, and those services, the contracts, the resources, including shelter, outreach, and prevention or diversion. Coordinating permanent supportive housing and transitional housing and rapid rehousing work. Overseeing contract management, performance management, technical assistance, incorporating the continuum of care that is held by All Home, that those funding and functions which are required by the U.S. Department of Housing and Urban Development to receive federal funding, and in addition to establishing the clear metrics and milestones, also doing mechanical things like co-locating staff and setting up interim leadership and developing the needed agreements to be able to act as one. All of those are short-term tasks that we can take on without having fully designed and chartered this new entity. We're going to be building this plane as we're flying it.
Yeah. And it's another thing once we have this entity established, we now can go to some of those deeper issues that are in the report. The city and the county and the region are leaving money on the table. There are resources that can help pay for this that we're not tapping because we're not structured to do it. For example, some of the behavioral health services that people need could be funded by the AZIA or other Medicaid waivers and those types of things. But we can't even get to that stage to get that money to bring it into our system. You look at the veterans benefits, disability benefits, Social Security. A lot of the people experiencing homelessness qualify for those benefits, but our system is so focused on just responding to the emergency, we're not doing what we need to bring those other resources to the table either. And if we get this in place and we can do that, we will see that we can help a lot more people become self-sufficient and stable by just using the resources that are available and not having to look to us for more resources.
Mayor, is this like the Homeless Services Authority that you maybe saw when you visited down in Los Angeles? Is that the concept here?
It's very similar to that, and I think as David said, is we've gone, we've met with San Francisco, which of course they have their county and their city are the same geographic boundary, so it's a little bit different. Los Angeles is very similar because there's many cities in Los Angeles. So we've looked at models across the country, and what we've seen is where they have made, substantial progress, there is unified governance to make sure that everybody is delivering the services, and there's one place for people experiencing homelessness to go to get the range of services they need.
Is there a region where you would point to that they have made substantial progress? San Francisco and Los Angeles have very significant homelessness problems. Is there a region you'd point to where they've used this structure and made progress?
Well, one of the models that we looked at long ago, and a lot of our work is premised on this, is Columbus, Ohio, and to some extent Minnesota, where they centralized their systems much earlier than we're now attempting to do. And as the mayor points out, we cannot guarantee the end of homelessness through this action or any action, but both areas showed significant progress, and both were set back during the recession as well. So these external factors are very hard for local governments to account for entirely. But what we're doing is really optimizing those tools and resources we have at hand, those things we can control, which then situates ourselves better to leverage state and federal government that are missing in this room for this conversation today.
And I'd also just add, there's different ways to measure progress. If you just measure progress by how many more people we are sheltering and housing, we've made progress. Right. The problem is more people have they're falling into homeless at a greater rate than we can sustain. Mm-hmm. And so that's another reason why we have to have this unified system, because if people measure progress just purely by the numbers has been indicated on people experiencing homelessness, that means by fact that we've got to go to those upstream root causes, and you have to have the most efficient system for delivery as possible.
Madam Mayor, I'm going to ask a question you hate to answer, which is the microwave question.
Yeah. Uber Eats.
Following up what Essex says, can you almost give people an assurance that property taxes, an increase in property taxes will not cover expenses for all this, or will there be a need for an increase of property tax?
Ever in the history of Seattle?
No. I think that people are criticizing how spending is being done right now, and now this entity needs to work itself out. But is it a possibility that this entity could call for an increase in property taxes, either in the cities and the counties?
I think it's premature to even talk about that, because I will say right now, nothing about that is on the table. What we're focused on is getting this work done, getting the people working together, having unified contracts, having a one place where people go, and making sure that our resources get pooled. We look to those other resources, and then we're going to be honest with where we are with the people. I think people want to see that we are doing what we need to do to make the most efficient, humane, equitable system possible. And only after they believe that do they want to have a conversation about anything else, including, how do we build more housing in the region and dedicate it to that? How do we change the criminal justice system, the foster care system, the mental health system? So there's a lot of questions upstream, but today's focused on we will say what we are focused on today is bringing the people who are there doing the work now under one roof.
Mayor Durkan, a unified approach in pooling resources, what does that mean for some of the more controversial approaches that Seattle has piloted, things like the tiny house villages that aren't accepted or necessarily seen as best practice elsewhere in the region? How is this entity going to influence things like that have been tried here?
I think that we will be working together. I'll let the executive do that. I would disagree a little bit that I think that those are as controversial and not accepted. I think people look at what are the services provided and whether they're enhanced or not. And so I think that that's a longer conversation. But
So every city and the county in the unincorporated area has the authority to control its own land use and zoning and decisions about buildings. And that's why we need buy-in from folks, and that's also why we need a single entity to be able to articulate what it is that is causing people to continue to be homeless and say, you know, this is where you're falling down, county or city X or nonprofit community. And so that we can have at least clarity about where the shortcoming is. And the fact is that a solution that works in Seattle is not going to be the same as a solution that works in North Bend or one that works in Skykomish. But we need an entity to be able to identify why people are homeless in each of those places. And don't think people aren't homeless in North Bend, because they are. There are folks camped out along rivers in unincorporated King County. There are folks in the highway right-of-way outside of Federal Way. You see the folks on the streets of downtown Seattle because that's where your offices are. But the fact is that this is a countywide challenge, and for each part of this county, there's going to be a different combination of solutions that's necessary, and it's going to require all of these entities, governments, nonprofits, business, and others, to come together to provide them.
What would you say to people who are, what would you say to people who would measure progress by simply fewer tents on the streets, and when is that going to happen?
Well, I mean, I think that's a very worthy goal and a good way to measure progress. The fact is that the best way to do that is prevent people from falling into homelessness in the first place. And the second most important thing is to get them exited out of, not just into the emergency shelters, but exited out of homelessness and back to self-sufficiency as quickly as possible. This entity will help us be better at that, and it will help establish the metrics that will allow us to hold ourselves accountable to achieve those things. I don't know if you want to add anything.
I would agree with that.
Will there be a single director of this entity?
Yes. And I believe we will have interim leadership. We have not worked this out either, but we'll have interim leadership in order to get it stood up and get it working. We don't want to have every I dotted and T crossed before we start to do this unified good work.
We will have folks available for one-on-one.
Yeah, and I would encourage you afterwards to talk with some of the folks who've joined us here. We have our outside consultants who've done marvelous work. We have experts from the city and the county, as well as the business and philanthropic community and providers to be able to flesh this out for you. But thank you for being here today. This is an important step forward for our region.
Thank you very much.